Dear colleagues and friends, good morning. Thank you for organizing this Lausanne workshop on scaling, linking, and creating action to drive global innovation in Alzheimer's disease. Dementia currently affects approximately 50 million people globally, and this number is projected to triple by 2050. The majority of people with dementia live in low and middle-income countries. The Global Action Plan on the Public Health Response to Dementia is the vehicle to support countries to develop a multi-sectoral response to address the dementia challenge. 3 years on, we see slow implementation progress in areas such as policy development, service delivery, monitoring, and research, and the need for accelerated actions. COVID-19 has brought a range of associated neurological manifestations such as delirium or encephalopathy, agitation, stroke, meningoencephalitis, headache, impaired sense of smell or taste. In many cases, acute neurological manifestations have been reported even without respiratory symptoms. Social isolation, reduced physical activity, and reduced intellectual stimulation may increase the risk of cognitive decline and dementia in older adults. People with dementia are seriously impacted by COVID-19, both in terms of morbidity and mortality. Increased morbidity as pre-existing dementia was associated with COVID-19 severity, increased mortality, as many COVID-19 deaths in long-term care facilities are attributable to people with dementia, ranging from 29 to 75% across countries. Risk of mortality is also increased for people with dementia who were hospitalized for COVID-19. Excess mortality, as according to the US CDC, deaths in people with dementia have increased by 15% to 36% during COVID-19 compared to previous years, likely due to disruption of services, social isolation, and rapid deterioration. COVID-19 related measures such as physical distancing and social isolation are linked to the emergence or worsening of neuropsychiatric symptoms in people with dementia, especially anxiety, apathy, and agitation. The World Health Organization has developed tools to assist member states in the action plan implementation, like policy guide, risk reduction guidelines, caregiver training. We will be launching more products soon, including a dementia-friendly initiative toolkit. WHO is also developing a blueprint for research and innovations to coordinate global dementia research efforts. The WHO's Global Dementia Observatory serves as monitoring mechanism for the Global Dementia Action Plan. The upcoming Global Status Report on the public health response to dementia, to be launched in 2021, will take stock of the implementation status of the Global Dementia Action Plan, drawing on the observatory's available data and other sources, and more importantly, will identify and outline a roadmap for accelerated action needed to reach the global dementia targets by 2025 and beyond. The 73rd World Health Assembly adopted a resolution calling for scaled-up and integrated action on epilepsy and other neurological disorders, and the development of an intersectoral global action plan on epilepsy and other neurological disorders for consideration at the 75th session of the World Health Assembly, which provides an opportunity for the world to accelerate actions. What is needed to accelerate action by and beyond 2025? A renewed global leadership and funding by individual countries is urgently needed to reinvigorate some of the momentum that previous high-level meetings, such as the G8 Dementia Summit led by the United Kingdom, the G7 legacy events, or WHO's first ministerial conference on dementia, which resulted in the development of a global action plan, have sparked. The G20 summit in Japan in 2019 prominently highlighted issues related to dementia and aging. However, plans to organize a second ministerial conference led by the Netherlands were unfortunately cancelled due to the COVID-19 pandemic. Investment in dementia research and care systems is urgently needed. COVID-19 lockdowns are endangering progress in these areas. Ongoing dementia research should cover critical areas within the full care pathway, including prevention, treatment, cure, and implementation science in ways that harmonize investigative approaches and reduce redundancies. Strengthening of health information systems to dementia to allow access to disaggregated data for evidence-based service planning, especially vis-à-vis disruptions to services during the COVID-19 pandemic. And finally, the integration of services for people with dementia and their carers under the umbrella of universal health coverage in primary health care. I wish you fruitful discussions during this 3-day workshop and thank you for your commitment to stop dementia by 2025.